We're going to review and clarify the functional medicine timeline matrix, all the things we talked about all day long. We're going to discuss the importance of understanding the patient's individual history, and I'm supposed to stand where the bright lights are. And we're going to identify key leverage points. We're going to define the components of the 5R framework. We're going to select and interpret functional medicine labs. There is a misunderstanding, though. People think that functional medicine is about all these wacky labs. It's not. In fact, I'll tell you that I rarely get labs on the first visit because there's so much other stuff to do, right? We're going to do a therapeutic diet. We're going to look at their sleep hygiene and their movement and all the things along the bottom. But these are teaching cases, so there's going to be a plethora of laboratories to look at. So understanding root cause. So the gastrointestinal system is really, when you think about chaos theory, it's kind of a point of symmetry. It's one of these nodes of complexity. And its dysregulation of the GI system can have profound impacts on health. And remember what Dr. O'Brien was talking about, this dig-in idea, the notion that the gastrointestinal system is related to, obviously, digestion and absorption, but also this idea of intestinal permeability, this idea of the flora and the microbiome, immune regulation and inflammation, and enhanced or rather enteric nervous system interactions. And there's really this complex two-way communication between the microbiome, the immune system, and the nervous system. So we have this triangle that's communicating in two ways. There's this complex interaction, the brain-gut axis, the brain-immune axis, the brain-neuro axis, and we want to learn how to exploit this for the patient's benefit. And this is a two-way communication. In fact, there's evidence that there's more information going from the gut to the brain than there is from the brain to the gut. And that brings us back to this complex interaction. And I think you've seen this slide before, but if you grok this slide, frankly, you get functional medicine. So food antigens and other food components, stress, infections, dysbiosis, inflammatory stuff, many different disease things, impaired digestion, stomach acid, toxins, nutritional insufficiencies, various medications can alter intestinal permeability. And that can increase uptake of food antigens, and that can lead to the whole molecular mimicry deal that was talked about previously. It can lead to malabsorption, malnutrition. It can lead to increased intestinal uptake of toxins and lipopolysaccharides, and that can lead to immune activation, inflammation, and systemic disease. And so functional medicine is really trying to deal with everything on the left side of that bracket. And one of those components is tell. So the go-to-it model that you learned earlier, one of them is tell. So try to think about the cases presented by Dr. Hughes and elaborated on by Dr. O'Brien, and think about the timeline, and let's try to tell a story. And I already told you the story should be told like Spielberg or Hemingway, and I'm going to fail, but we're going to try. So again, mastering the story, be an awesome interviewer. Of course, I can't think of his name, but an interviewer once said, the difference between me and Dan Rather is Dan Rather would say, what was it like in that burning building? And this guy said, but I asked, what did it feel like to be in that burning building? And it's a very fundamentally different question. You know, we're so used to very pointed questions to get to a very specific outcome in acute care medicine. We want to ask a very different kind of question in our interviews. We want to think deeply about the context of the story. We want to think deeply about the physiology behind the story. You know, people will say outrageous things that simply are not physiologically possible. But it's their interpretation of what happened. So rather than just blowing them off, we have to think about it's their story in their context, but we have to put it into the biomedical context and try to understand the physiology behind the story. People will say, and this is an important thing about the timeline as well, people will say, I know it's that drug. I've been taking that drug and it's making me sick. When did you start the drug? Well, I started the drug in January. How long have you been sick? 4.5 years. Yeah, we got a problem. So, but people do this. They just don't think about the time sequence. All they know is they have an issue and they want it to be easy to fix, and if they just stop the drug, it'll all go away, right? You got to be patient. When I was a kid, we played this game where you had a chalkboard and somebody described a picture they were looking at and you had to draw the picture. Sometimes you draw this elaborate picture and then one word would come up and you erase the whole thing and you'd write a whole new picture and that'd be right. It's, if you listen to every detail and you're patient, new pictures will emerge. So allow the story to unfold. Don't be interrupting. Don't be the heckler. Be the audience, not the heckler. And then when you do ask a question, make sure it's a question that elaborates on their story, that helps them amplify their story. Because they're telling this story for a reason. So be inclusive, not exclusive. Look for patterns that connect. Think about, again, their readiness to change. And then telling the story to recreate meaning. We need to be the copy editor of these patients' stories. They have created a story that somehow justifies their chronic illness because they've been told they have this awful thing and you're, so sad, too bad. But we can recreate meaning. We can edit this story. We can help them edit this story. We can connect, educate, inspire, motivate, and then we can activate nature, because the truth is we don't heal anybody, do we? Nature heals. Voltaire, I believe, said the art of medicine is entertaining the patient while nature cures the disease, and that's kind of where we're at. So we've gathered, we've organized, we have a timeline and a matrix, and we're going to tell. So what is Jane's story? So here's a conventional story. I think it's a pretty decent story for a conventional encounter. Joan, you appear to have irritable bowel syndrome and depression. Great news. We're likely to kill two birds with one stone. Antidepressant is going to help you with your depression. And the nice thing is that one of the side effects of the antidepressant is kind of a constipating effect. So it's going to help you with your IBS. So here's your script. Pick it up at the pharmacy. We'll see in a little bit. If this doesn't work, we'll probably send you for a GI workup. Thanks. So how do we tell the story in a functional medicine context? Well, we use the timeline, we use the matrix, and we use the ATMs. So here's the timeline. Looks kind of complicated, but the elements I'm going to use the antecedents. And I'm going to start my story by saying, gosh, I think the reason we're sitting here today is, because of things that happened before you were even born. And I'm going to talk about the antecedents. And then we're going to, pick out certain things that I've identified that I think are triggers. And certainly talk about symptoms. So, you came to me telling me that you've had a few years of gut issues. But really, when we look at this carefully, you've had gut issues since you were a toddler or before. Even as an infant at 6 weeks old, you had colic. And we're going to go on from there. And then we're going to look at I'm just preparing myself to tell this story. We're going to look at the matrix, and then we're going to pull out those antecedents. So the antecedents are the family history of IBS and diverticulitis, bottle fed starting at age 4 weeks, and that, certainly not doing her colic any good. History of multiple antibiotics, history of tonsillectomy. Some of the triggers as we see them are the multiple antibiotics, the standard American diet, impaired digestion by laboratory, blastocystis on culture, and increased intestinal permeability. So again, these are the elements I'm weaving into my story, and then mediators are these things. Adiposity being an inflammatory condition, depression being an inflammatory condition, nutritional insufficiencies contributing to those things. So here we are. I pull out my timeline, and I often set it down so the patient can see it, and I say, listen, I want to tell a story. This is the story as I understand it that we've been talking about, but this is a discussion. If I say something that's just way off base, I really want you to stop me. And if you feel something needs to be amplified, I really want you to contribute. And then I'm going to say some kind of, gosh, this has been a long, difficult road for you. And I'm going to talk about her current symptoms. We've got, you've got all these symptoms. You've got this gas and bloating and frequent stools and this very sensitive stomach and these feelings of incomplete voiding and very low energy and this poor mood. And obviously this has been plaguing you. But the reason we're sitting here today, I think really started before you were born. And I'm going to tell about, your mom had this seasonal affective disorder, and there was this family history of these gut issues, and those are both really probably inflammatory conditions. So I think you were kind of preloaded to have some inflammatory propensity, some ability to get inflamed better than other people. And then you had these antibiotics, and I think that just was a little bit of fuel on the fire. There's this thing in your body called a microbiome. It's this teeming ecology of bugs in your gut, these bacteria in your gut that are healthy, good. They're supposed to be there. So when you've had antibiotics, it can impair that microbiome, and that microbiome is really important for your immune system function. And in fact, you had so much difficulty and so much immune impairment that it caused a tonsillectomy. So I think this is like, a little bit of the perfect storm coming together. Then you had some issues with food very early on, and you had to go to, bottle feeding. And then that was at 4 weeks, and at about 6 weeks, you have colic. So I think we've got some issues here already. Then the antibiotics that we talked about, more disruption of the gut, and then abdominal pain starting at a pretty early age. You were missing a lot of school. You had this GI evaluation, and they told you at some point that it looked like you had lactose intolerance. And as you understand, lactose is the sugar in milk, but removing sugar in milk, removing that lactose should have been a cure, and it wasn't. So I think there's more going on here than just lactose intolerance. And then I'm going to jump up here. I'm going to talk about how some of these symptoms are coincident with very stressful things. So I find it very interesting that, your abdominal pain is kind of coincident with your parents getting a divorce. And we talked about how that divorce was very stressful for you. There's this part of your immune system called the autonomic nervous system. And your autonomic nervous system is also known as fight or flight. It's the way your body prepares for danger. And whether the danger is the divorce of your parents or being chased by a saber-toothed tiger, it's the same response. So functionally, in this area, you're being chased by a saber-toothed tiger. And what does that do? Well, it shunts blood away from your gut. So your already impaired gut function from all of the colic and the antibiotics and all the things we already talked about is now weakened even more. And the ability to repair those tissues is impeded because of the lack of a robust blood supply. Plus, we know that when we do that, we're going to leave fermentable product behind, stuff that's, you've eaten, it doesn't get absorbed properly. And when it doesn't get absorbed properly, it also alters this microbiome. And then we know that 70% of your immune system lines your gut, so you're shunting blood away from your immune system. So the problem is kind of getting bigger, and your capacity to fix it is sort of getting smaller. And it's no real surprise that your symptoms have escalated over time. At first it wasn't that big a deal. It was some colic, and then it was some ear infections, and then it was some belly pain. But now it's really life-altering. So I think that's how we got from this idea of being well to being unwell. And how are we going to get back? Well, we need to do a few investigations, but initially we need to fix this stuff we're talking about. We need to look at this condition known as leaky gut and try to repair your gut. We need to look at your microbiome. We need to try to reduce this inflammatory response you're having. And interestingly enough, these symptoms that we're sitting here while you're here are really the common thread here is inflammation. So, and the problem is, you know, you've probably taken Advil 100 times in your life and didn't make all these things better because Advil actually makes leakiness worse. So we need to use a different strategy for reducing your inflammation. And then we'll go into a little more detail depending on the place we're at. And we're going to build over the rest of the conversation. We're going to build over the next 2 hours a treatment strategy based on this story and based on the 5-hour program. What I'd like to do next, I want you to build a better story than I just told. What did I leave out? Look at this timeline. There is a ton of information. You could go into much more detail about the psychosocial stressors, about her own marriage, about the kids and her teenagers and having a difficult time with making ends meet and all kinds of things that could be added to this. I want you to just think about that. So functional medicine is not catching them as they're going off the waterfall in a barrel, but catching them upstream as they step into the water. I was in northern Minnesota a week or so ago on the north shore of Lake Superior, and I'm a mountaineer and a rock climber. I'm like used to climb really big pieces of rock like El Capitan and climbed big mountains like, Denali, and we're at this waterfall, and there's these people who clearly are like tourists in flip-flops, and they are like, there's water, and the rocks are slippery, and they're like doing this over the edge of the thing. They were places that as an experienced mountaineer who was third class, like, serious climbs, I wouldn't go there. People just don't know, right? They don't know. And if you don't know what you don't know, it can be very dangerous. So we try to catch them as they're stepping into the water. So we've told the story. We're going to try to order our priorities. One of the slogans of functional medicine is, unless there is a compelling reason to do otherwise, start in the gut. So we're going to talk about a way to start in the gut. We're going to talk about how to build a scaffolding onto which we can hang things and kind of know how to do this. So the first thing is, what is 5R? Remove, replace, reinoculate, repair, and rebalance. So 5 basic questions. What do we need to remove? What do we need to replace? And do we need to reinoculate or repair the inoculum? And do we need to repair the gut mucosa and the biofilm? And then how do we help this patient rebalance their life so that they don't just get right back into this condition? So let's look at remove a little bit. We want to remove foods which the patient may be sensitive, intolerant, allergic to, and there's going to be lectures on that topic. We want to remove pathogenic and potentially pathogenic bacteria, fungi, and parasites. We want to remove environmental stressors such as pollutants, and then other stressors. So clinical approaches, they may include a fancy word, an oligoantigenic elimination diet. That's low allergy elimination diet. Botanical antimicrobials, bacteriostatic, bactericidal pharmaceuticals, antibiotic, antifungal medications. What about replace? Refers to replacing factors that may be inadequate or lacking. So, digestive factors, hydrochloric acid, pancreatic enzymes, bile salts, fibers, and so on. And then reinoculate. And here's what I think. I think that if I do a biopsy of somebody's liver, I expect to see hepatocytes. And if I do a biopsy of somebody's brain, I'm hoping there are at least a few neurons. And if I do a biopsy of the microbiome, I expect to find lactobacillus and E. coli, right? So it can be important. So, clinical applications, consider probiotics. Maybe you give some bifidobacterium or lactobacillus, or maybe you try to kind of think about a restart, push the restart button and give them Saccharomyces, which won't actually colonize the gut, but might crowd out a lot of the bad boys and girls. And then prebiotics. Prebiotics, as Tom O said, are things that we can't digest that the bugs can, right? So reinoculate refers to reintroducing a desirable flora, and we have probiotics, prebiotics, and symbiotics. Symbiotics is just a big word for mixing probiotics and prebiotics. I used to be all over probiotics. Probiotics don't change anything. They're just placeholders. The real change is the change of their diet and the incorporation of a greater abundance and variety of prebiotics. So what about repair? Repair, provide nutrients to support healing and regeneration of the gut mucosa. So clinical approaches, nutrients important for GI repair include glutamine, arginine, vitamin A, vitamin D, vitamin C, zinc, all these things. Mucosal lining support, phosphatidylcholine. Mucosal secretion protectants. Support for the gut-associated lymphoid tissue, the GALT. So lactoferrin, lactoperoxides, whey immune globulins, serum-derived immune globulins, colostrum. If it's not on the list there, it isn't. Antioxidants known to have function in the gut. So any antioxidant that isn't easy to absorb would be really great for the lumen of the gut. And then nutritional and phytonutritional anti-inflammatories. Curcumin, fish oil, things like that. What about Rebalance? Scheduling. Well, scheduling makes me like have a panic attack. I don't know about scheduling, but because I'm overscheduled. Mindful eating, though. You know, how about just sit down when you eat? No more eating in the car. Heart rate variability, biofeedback, meditative practice, yoga, prayer, breathing, other centering processes. How about some, like for me, psychotherapy? So, you know, this 5R program is a way of just thinking about the things that we need to do. So, this lecture is brought to you by the letter R, matey.